Now get ready for the test and follow the instructions. Tasks 1 to 4 instructions. You will listen to a short audio or video recorded conversation and answer the questions. While listening, select the correct answer from the options provided for each question.
Task 1, Patient Care. You will watch a dialogue between a nurse and a patient in a video scenario. You will get 45 seconds to read the questions.
Listen to the recording and select your answers.
Hello, Mr. Thatch. It's nice to meet you. How are you today?
Okay, I guess. You can call me Jack, by the way.
Okay, thanks, Jack. So, you were referred by a doctor in the A&E for an episode of dizziness.
Yes, and I still feel a bit unwell, even though it has been about an hour since the dizziness began.
So, let's talk about your health recently. How have you been feeling lately?
I was feeling quite well until about 6 months ago. I have had a few falls, not often, but enough to worry me.
I see. When you have fallen, have you lost consciousness?
Yes, a couple of times, and as I live alone, I don't know how long I've been out when I come to. I've also grazed my knees a few times.
Okay, and have you also felt dizzy before?
Yes, sometimes I feel dizzy and have to sit down to avoid passing out. This has happened a few times after I was doing some work outside, but it happened last week when I was just sitting there.
How long does it generally take for the episode to pass?
I would say it takes about 10 to 15 minutes.
You said you lived alone. Has anybody been with you when you have had one of these episodes?
Most of the time, no, but my granddaughter was with me once. She got so worried that she called an ambulance. She said I looked so pale she thought I was dead. By the time they got me to the hospital, I had completely recovered. They told me I had a normal electrocardiogram and a normal chest x-ray, and they discharged me.
Okay. So I can see from the initial physical examination done in the A&E, you were pale when you presented in the A&E. No heart murmurs were detected. Let me look at the ECG that was just done.
Well, what are you thinking it might be?
Well, your loss of colour suggests a loss of cardiac output associated with arrhythmia, which is a problem with the rate of rhythm of your heartbeat. It means that your heart beats too quickly, too slowly, or with an irregular pattern. Yes. Your most recent ECG is showing a complete heart block. The episodes of loss of consciousness are what we call Stokes-Adams attacks and are caused by rapid heartbeat or tachyarrhythmia. You likely started out with a partial block, but now it seems that you are in a stable, complete heart block.
Does that mean the blood in my heart isn't flowing? How is that possible?
No, A heart block is an abnormal heart rhythm that occurs when the electrical impulses that tell your heart when to beat are delayed or blocked as they travel through the heart.
Oh, no. And what is the treatment for that?
The treatment is the insertion of a pacemaker, which will help monitor and control your heartbeat. With the pacemaker, if your heart rhythm is abnormal, the computer in the pacemaker will direct a generator to send electrical pulses to the heart.
So you have to insert it in my chest? Is that major surgery?
It does not require open heart surgery, so it is not as serious as you might think. In fact, most people go home within 24 hours.
You will now have 45 seconds to review your answers.
Task 2, Patient Condition. You will watch a dialogue between a nurse and a patient in a video scenario. You will get 45 seconds to read the questions.
Listen to the recording and select your answers.
Hello, Mr. MacDonald. I understand you're here to have a lump removed from your back, and the plan is to send you home later today.
Yes, that's right. The lump really needs to come off. It's more than a little annoying, and it can be quite painful too. It's near my waist and gets in the way of the waistband of my trousers. I'm not particularly worried about the surgery. They explained everything to me very clearly when I was at the assessment clinic, but I am concerned about how I'll go later on when I'm recovering. Did they tell you I have Parkinson's disease?
Yes, it's here in your notes from the clinic, but it doesn't say how long you've had it or anything about how it affects you.
Oh, I've had it a few years now. 5, I think. The walking is the worst. It's difficult to start moving, and I'm so slow. All I can do is shuffle to start with, and then my steps get shorter and shorter, and I get faster and faster. Sometimes I even fall over.
Right, I see.
I also sometimes get that freezing thing that happens. You know, where you're stuck in the one spot. Aching something, I think they call it.
Akinesia.
Yes, maybe. You'd know better than me. Anyway, it'll come on me when I least expect it, and always at the worst possible moment. I worked out that if I try and do more than the one thing at once, that almost always brings it on. I also get this terrible shaking in my hands, and it's hard to do some things because my arms are so stiff.
What activities are most difficult for you?
It sounds ridiculous, but it's mainly things like turning over in bed, reaching for a glass of water or a plate of food, getting up out of a chair and then turning around once I'm standing. That can be a challenge. I've learned a few tricks to help though, like having a good firm mattress and a high back chair with arms.
What about activities that need fine movement? How do you manage with those?
Well, tying my shoelaces is a real problem, and buttons, doing those up is almost impossible. I like that material that sticks to itself. It's very handy. What's it called again? Velcro, that's it. Also, my handwriting is terrible. I've basically given up on it.
It sounds like you might benefit from seeing an occupational therapist.
Yes, maybe. I'll speak to my GP about a referral. One of the other main problems I've had during the past 12 months has been the cramps I get at night. They really ruin my sleep.
I understand your medication has been changed recently.
Yes, that's right. I said to the doctor they'd gone on for far too long, so she said I should try some different tablets. I've only been on them for a month or so, but I think they've really reduced.
You will now have 45 seconds to review your answers.
Task 3 Patient Care. You will watch a dialogue between a nurse and a patient in a video scenario. You will get 45 seconds to read the questions.
Listen to the recording and select your answers.
Now, Mr. Parr, I can see from your GP's notes that you've been experiencing some unusual symptoms recently.
Well, yes, that's right. You see, it's come on gradually over the last few months. The pain, that is. It began in my hips and it slowly got worse. It soon spread to my lower back, mostly on the right side. I thought I'd just been working too hard and a good rest would sort things out, but I actually find it the opposite. It's much worse after I've slept, and it actually feels better following a bit of exercise, which is hard to understand.
And is the pain still there in your back?
Yeah, but not only there, it's now pretty widespread. Makes me rather moody, to be honest, which isn't like me, because it's now on both sides and it's gradually gone into lots of different areas, like my shoulders.
Okay.
What's most annoying is it now hurts to walk sometimes, because it's even in my heels now, at the back of them, here. It's really quite tender.
I see. That must make things difficult. And have you noticed any other symptoms apart from the pain, I mean?
Well, I'm tired an awful lot of the time, and something strange I have noticed just recently is my eyes. I've noticed they feel pretty sore for some reason, and they're watery, too. And sometimes I can't really see properly. Things look quite blurred. I've lost my appetite, too. I just don't feel like eating half the time, and I used to be a really good eater.
And looking at your GP's notes from your last appointment, I see that she sent you for some blood tests?
That's right, and she told me the first one showed I had mild anemia.
Okay.
That could be why I've felt so tired these last few months, I guess. She said that the following test showed some inflammation, too, which she said was in the bowel. I think that might explain the loss of appetite.
And have you found anything that helps with the pain?
Nothing makes it go away for any length of time, to be honest. Though I do find that heat often soothes it, heated pads and warm showers. But the pain always returns soon afterwards. Something which does seem to help a little is yoga. A friend of mine teaches it. She showed me a few exercises to do. I mean, it doesn't get rid of the pain, but it seems to ease it. She suggested acupuncture too, which I tried, but I gave up after a few dozen sessions. It just wasn't making any difference at all. That was disappointing because it was quite expensive, actually. The same friend's just lent me her TENS machine, so I've started using that. It's a funny sensation, the pads on my skin. and I'm not sure if it really helps or not, but I'll stick with it for the moment.
I see. And what about your family? Does anyone else have the same sort of problem?
Not that I know of. I mean, I'm an only child, and my dad died about 6 months ago. He had advanced lung cancer. My mum's pretty well overall. She even helps out sometimes with my work admin, which I really appreciate. I'm a plumber. I work for myself, and she knows how difficult it's been recently with this pain. It's affecting me quite a bit, to be honest. I mean, I still try to see my friends every weekend. We used to go 10-pin bowling, and I enjoyed that, but I don't go anymore. I seem to concentrate very well these days when I'm doing anything like that.
You will now have 45 seconds to review your answers.
Task 4. Patient care. You will watch a dialogue between a nurse and a patient in a video scenario. You will get 45 seconds to read the questions.
Listen to the recording and select your answers.
Mr. Smithers?
That's right, Toby Smithers.
Now, I think you've been having some stomach problems.
Yes, that's right, for some time actually.
Okay, I've got some notes here, but perhaps you can tell me in your own words about those problems. About any treatment you've been having or anything else you can remember that seems relevant.
Okay. It all started about 9 months ago with a stomach upset.
Okay.
I thought I'd caught the vomiting bug that was going round.
Yes.
Basically, I just couldn't keep anything down. No diarrhea or anything, but it was pretty bad.
Right.
Anyway, it cleared up in a couple of days, and I went back to eating normally. The thing was, though, from that time on, whenever I had a meal, lunch or dinner, I'd feel incredibly sleepy almost before I'd finished, and for about half an hour afterwards. I didn't feel tired as such. I mean, not in the sense of fatigue. It's just that I could hardly keep my eyes open.
I see. Were you in any pain?
No, none at all. The only other symptom was that I was getting very thirsty, especially at night, so I was drinking a lot.
Right.
So I went to see the doctor, expecting some simple explanation, but she said my symptoms were quite unusual. Well, not the drinking. She explained that the stomach upset had left me dehydrated.
Yes, that's right.
But it didn't explain my other main symptom.
And the dehydration passed?
Yeah, that was just a temporary thing. Then she asked me if I'd ever had stomach cancer, which was a bit worrying.
But you haven't?
No. But then she explained that there's a condition that has similar symptoms to those I had. She didn't think I actually had that condition because it generally affects people who've had stomach surgery, and I hadn't. It's called gastric dumping syndrome.
Oh, yes.
Anyway, what she suggested as, like an interim measure was following the treatment plan for that syndrome, even though I probably hadn't got it. So I had to keep drinking because I needed to keep my fluid levels up.
Yes.
But not whilst I was eating. So in other words, I had to separate the two activities by about half an hour. Then as for the meals themselves, she suggested an eating regime that she called little and often. So, no major blowouts and no skipping meals either.
Sure. Did that help?
Yeah, it did, but it was only meant to help me in the short term. Because meanwhile, I had various tests, urine sample, went for a blood test, neither of which showed up anything untoward. So I just hoped it'd clear up of its own accord.
But it didn't.
Well, no. The regime worked all right, but as soon as I went back to eating and drinking normally, the symptoms would come back.
Okay.
So the doctor referred me for an endoscopy. I saw a gastroenterologist for that. He'd looked at my other test results and examined me and everything.
Sure.
And of course, once the results of that came back, they showed that I'd got Helicobacter pylori.
I see.
So I went on the course of treatment, the 3 drugs for 2 weeks,
Yes.
2 different antibiotics and an antacid. That's the combination which gets rid of it.
Yes.
After that, I went back for a breath test, and that was all clear. So I thought that'd be the end of it, and I'd be back to normal.
But you're not.
Well, I've given it a couple of months, but the symptoms are the same.
Okay.
If I stick to the eating regime, I'm okay. When I come off it, I'm back to square one. So I'm thinking, sure, the stomach problem that the gastroenterologist found has been dealt with, but that wasn't what was causing the original problem.
And how's this affecting your everyday life?
I can live with it. Obviously, it would be different if I was driving for a living or operating machinery, but I'm a teacher, so it's okay. But to cut a long story short, I asked for a second opinion, and so here I am.
You will now have 45 seconds to review your answers.